and thank him for taking the time to meet with us. The governor has been a long-time friend of ABNY, of mine, and of my family's. But most important, he has been a partner in ABNY on so many initiatives over the years, from helping to protect New Yorkers from COVID, to helping us reopen smartly, from developing real infrastructure around the state, to keeping New York strong and competitive. Over the years, he's joined us to discuss priorities for the state, and we're glad he's here today. Because this is an intense time. Our city and our state are on the path back, and you can feel that energy and that power of people coming together and reigniting what it means to live in the greatest and most diverse city in the world, in the greatest state in the world. At the same time, we face new challenges, with the Delta variant posing a real and not yet fully understood threat to what's ahead. As the governor said yesterday, New Yorkers beat back COVID before, going from the highest positivity rate on the globe to one of the lowest, by staying smart, following the science, and having each other's backs. We did that under his leadership. So when he says that's exactly what we'll keep doing in the next phase of the pandemic, we know that's what he is going to fight for. Together, we will fight back this challenge. Governor Cuomo has joined us at critical moments over the years, and it is starting to feel like a critical moment once again. We're grateful to have him with us here this morning so we can hear a little more about the year that's passed, what's ahead, and specifically his plans to fight the Delta variant. Governor, we know you're deeply committed, deeply talented, and always firm in your opinion. Welcome back to ABNY. Governor Cuomo, the Zoom is yours.
Thank you. Thank you very much, Stephen. It's good to see you. And you're right, we go back many, many years. I like the beard, but I consider it a COVID beard, and I assume when we are past this next challenge of the Delta variant, you'll go back to the beardless Stephen Rubenstein. But Stephen, thank you very much for everything you do for everyone in this city and in this state. Your friendship, your leadership has been key. And ABNY, thank you. Thank you for having me once again to speak at this critical moment, because Stephen is exactly right. This is a quote-unquote intense moment, and it's a pivotal moment. And we all have to work together. And ABNY is key to that. Let me talk through some facts as to where we are, because this is an ever-changing situation. You know, we talk about the state of the state. Normally we do that once a year. We talk about the state of the city. Normally we do that once a year. In these times, the state of the state, the state of the city changes on a weekly, if not daily basis, depending on what's happening with COVID. As Stephen said, the economy is coming back. The numbers statewide are very good. The economy in New York City is not coming back as fast as we're seeing the economy in the rest of the state coming back. So we do have a special concern for New York City. But what happens is going to be a function of what we do. There is no preordained path here, my friends. You tell me what we do, and I'll tell you where we wind up. And there's no doubt that this is truly a pivotal moment. And you can see two paths. It's a path of promise and growth, and there's a promise of peril. There are tremendous challenges, but there is also tremendous opportunity. Now, we have to do two things at once. We have to manage this COVID increase, and it is real. But at the same time, we have to have an affirmative plan to bring back New York State and New York City. New York City is not going to come back on its own. I firmly believe that. It's going to require a strategy, a plan, and execution. What makes this an especially difficult time is we have to do both of these things simultaneously. So you need a plan to do it, and then you have to execute the plan. And what government often falls down is, frankly, on the execution. Government does very good with press releases. It's the actual delivery where government tends to fail. Let's talk about the COVID increase first. There's no doubt that the Delta variant is real. You see it in the numbers. Today we have 2,200 cases. 1 month ago, basically, we had 275 cases. So the increase in the numbers is real. It's not an overstatement. It's not a fabrication. Great news, 75% of adults have been vaccinated. That is higher than the national goal that was set of 70%, and it is extraordinarily high when you think about it. 75% of New Yorkers. This is a diverse state. If you ever told me that we could get 75% of New Yorkers to do any one thing, it was a very ambitious goal. But 75% got a needle in their arm, they got the vaccination. However, that leaves 25%. Now you can say, well, that's only 25%. But 25% in the state of New York is 3.5 million people. That's larger than the population of 21 states. That's a very large population of unvaccinated people. And what we're seeing is a pandemic among those unvaccinated people, but it affects everyone. We have to go back and remember what we learned painfully, but successfully, over the past 18 months. We did have COVID first and worst in the nation. Why? Because the COVID virus went from China to Europe and came here from Europe through our airports. We know that now. We know that this federal government failed to detect the COVID virus moving from China to Europe. We know there was a failure to detect the virus coming from Europe to New York until it was late. We look back now with retrospect, hindsight is 2020, we had COVID cases before we knew it was COVID. We had a period of time where people were dying from what they called pneumonia. It wasn't pneumonia, it was COVID. But we took that highest rate and we brought it down to one of the lowest positivity rates in the country. No one thought it was possible. We were on the verge, my friends, of pandemonium and chaos. We were about to overwhelm our hospital system. But New Yorkers rose to a challenge that they had not done in a generation. Now, when we were going through this, remember what was going on. Other parts of the nation were saying, well, this is just a New York phenomenon, almost as if it was something about the immune system of New Yorkers or the political ideology of New Yorkers. State of Florida, for example, said, well, New Yorkers should be quarantined. We don't want them coming to Florida. You had a lot of New Yorkers leave New York in the beginning days of COVID because it seemed like it was a New York phenomenon and go to Florida. Meanwhile, Florida was saying, well, this is not a problem that we have to address. Really. Now Florida is seeing the greatest increase in COVID cases in the nation. What's the lesson? Denial does not work. Follow the science, follow the facts. We were aggressive, we showed leadership, and it worked. And we have to do the same here. We did make hard decisions. But in battling a virus, you have to make hard decisions. We learned that also. We know where this Delta variant is spreading. We have done a zip code analysis. You have 117 zip codes in New York State, which is only about 6.7% of the state. But in those zip codes, you have high positivity and low vaccination rates. And that's the dangerous connection. We can tell you exactly where they are. Primarily in New York City, of 60%, which is not surprising because that almost mirrors the population. But even in New York City, it's in certain locations. And that tracks the vaccination rate and the positivity rate of COVID almost from day one. You also see it on Long Island, about 18% of the zip codes, but again, targeted in places in Long Island. You see it across upstate New York, but again, targeted in certain communities in upstate New York. The CDC announced new guidance yesterday, and they have different colors for transmission rates. They have orange zones, they have red zones. They say at the same time, schools from K to 12, everyone should wear a mask in those schools, and then special precautions for these orange and these red zones. The state's going to do a full review of the CDC guidance. I was on the phone with them this morning. We're talking to federal officials. We're also talking to international health experts. One thing I learned from the first go-around, this is happening in other places. So learn from that experience. And we're doing that. But the CDC guidance should be carefully reviewed. Local governments in those areas should seriously consider the CDC guidance. And the basic guidance comes down to what we know. Get the vaccine, and the precautions are important, especially important for elderly and immunocompromised people. Take the mask precaution. It's not the hardest thing to do in the world. But the Delta variant is in many ways deja vu all over again. This is just another variant of a virus, and we know how it spreads and what will happen. President Biden is reported that he's going to announce soon that all federal employees must be vaccinated or get tested. New York State is doing the same. And we're working with our unions to implement this quickly and fairly. But we want to get it done by Labor Day. And I encourage all local governments to do the same. It's smart, it's fair, it's in everyone's interest. But we have to go further. And New York led the nation in going down the path that made the most sense, even though it is hard. And this has been the frustration for this country from the beginning. Politicians don't like to suggest actions that are not popular. A politician who suggests too many unpopular options is not a long-term politician. But there's a choice of doing the political thing or doing the right thing. And I've always chosen to do the right thing. And I believe, ultimately, that is even the best politics. But I think we have to go further here. I think we need dramatic action to get a control of this situation. So in New York and our state hospitals, all patient-facing healthcare workers must get vaccinated. There will be no testing option for patient-facing healthcare workers. That is a point of contact that could be a serious spreading event, and we want to make sure that those healthcare workers are vaccinated, period. If the numbers continue to go up the way they're going up, I think school districts in those affected areas should strongly consider taking more aggressive action. And it will be hard. And I understand the politics. But I also understand if we don't take the right actions, schools can become super spreaders in September. It will happen. We have seen it happen before. And trepidation and politics that stops aggressive action feeds the virus. The virus feeds on our lack of action and on our apathy and on our fear. Schools in September will be places of congregation, and they can be super spreaders, especially when you put it together with the fact that you already know you have a high concentration of infection in those targeted areas. I also encourage the FDA to issue final approval of the vaccine. This vaccine right now is under something called Emergency Use Authorization. Under Emergency Use Authorization, states are limited as to what they can mandate. Once the vaccine is finally approved, then the state has more legal authority to mandate the vaccine. For those local governments who have the targeted zip codes, we're doing advertising, we're doing incentives, we've done all sorts of giveaways. There is vaccine hesitancy. It is real. I don't think we get past it with television ads. I think you have to talk it through with people who are hesitant, give them the facts. And I think it has to be done with people who they relate to, community representatives who they relate to. But we know the targeted areas. Reach out to them. Use the community organizations. We just provided $15 million in funding for community organizations. Hear them out, talk it through, get them the facts, and let's get people past their hesitancy. I also think private sector businesses can help, and I think you can play a major role. You can admit vaccinated only people into your establishment. I can argue that it is a smart business practice because I want to go to a safe restaurant, and I want to go to a safe theater, and I want to go to a safe bar. And I think it's good business for the private sector. I also think it provides a real incentive for people to get the vaccine. We have done this before. New York pioneered this. Radio City Music Hall, Jim Dolan, showed real vision. Back in May, Radio City opened up with only vaccinated people. It was the first main venue in New York to do it. I believe it was the first main venue in the nation to do it. And it worked. Others have followed that model. Theaters have done it. We have sports stadiums that have done it. More businesses should do it. It will, again, I think, be an incentive for the business, and it will be an incentive for people to actually get the vaccine. And I urge you all to do it. Second challenge that we must do at the same time. We're fighting COVID with one hand. With the other hand, we have to get to work reviving the New York economy. What are the challenges? And let's be honest about this, because it's what I hear from people all day long. Zoom does not go away. Zoom showed society a different way of relating and working. And you know what? It has upsides. A lot of people will say it's not so bad that I can work from a remote location and do my work but still be at home. People are going to have to want to come back to work. And they're going to have to want to come back to New York City. And they are asking and saying good points that we have to hear. They are afraid of the crime rate in New York City. And I wish I had $1 for every time someone said to me, I just don't feel safe in New York City. Homelessness is a major problem in New York City. It's sad to see people in that situation, and it can be dangerous. That is the truth. That is the irrefutable truth. And too many people say, New York City is too expensive. I'd rather stay where I am and not pay those New York City taxes. These are real impediments that are not easy to say, but if you don't acknowledge it and you don't overcome it, it will defeat you. Now, this is not a slight issue. Remember, we have to get people back, and we have to get people back in volume. If you were to see a 15% decline of people coming back to New York City, that would have a devastating impact on the commercial market and all the businesses, et cetera, that rely on it. The flip side is also true. We are in an international competition. The first state and city that actually tackle these issues, I think, has an opportunity to lead going forward in the new generation. Address crime, address homelessness, show people the future that you can build, and provide tax relief. If we do that, you will see New York take off like a juggernaut. I believe it. On the issue of crime and gun violence, this is a national phenomenon, but New York is a place of leadership. We do have to reimagine policing. We do have to deal with the very real tension between the police and the community that erupted at the George Floyd murder. That is real. You can't ignore it, and it is hard. The New York PD, NYPD, they have real concerns. The community has real concerns, but ignoring it doesn't work. Admit it, address it, and let's make that relationship work once again. Same with gun violence. On homelessness, we need a different political philosophy when it comes to the homeless. I've worked on this issue all my life. We know how to do this. I did this as a not-for-profit operator. I did this when I was in the federal government as HUD secretary. I worked on this issue all across the nation. We know how to help homeless people. But we have to change this philosophy that helping the homeless is allowing them to sleep on a bench or allowing them to sleep in subway tunnels. How absurd is this? This story starts with deinstitutionalization. The state mental hospitals were terrible 50 years ago. We have to get people out of state mental hospitals into community group residences. We then either didn't build the community residences or there are not enough rules to keep people in the community residences, so now they're sleeping in a subway tunnel. You made progress. You went from deinstitutionalization to people sleeping in a subway tunnel once again. That's not progress. Offer safe shelters and services. You know what the homeless tell me on the subways? They won't go into a shelter? It's unsafe. When you get to a point where the homeless believe subway tunnels are safer than city shelters, you have a problem. And we need to build more supportive housing for the mentally ill and people with substance abuse issues, et cetera, and disabilities. We can't afford not to do it. But it starts with a change in philosophy. We are back to the days where we defended the civil rights and civil liberties of a homeless person to sleep on a grate. We should be asking more than that. Not defending their right to sleep on a park bench, but defending their right to a safe shelter and services and a humanity in response. I believe the New York City mayor gets it. I know Eric Adams many years. I worked with him when he was in the state legislature. I know him. I know his values. I believe he understands this. Equally important, I believe he can actually do it. There's two elements when you go to judge an elected official. Do they get it? Do they understand it? Their philosophy? And second, do they have the competence to actually get something done? Which is easier said than done because this is a big bureaucracy and everyone has a political opinion. And it takes a special personality to lead in the face of opposition. I think Eric Adams is going to do a great job for New York, and I'm excited to work with him. And third, we have to get about our business. We have to build a new New York for a new